New York does remain the epicenter of the coronavirus outbreak in the U.S. Doctors, nurses, and medical teams who are in that state are bearing the brunt of a surge of seriously ill patients. William Brangham recently spoke with two who are on the front line about their work.
Adam Bliden is an EMT, an emergency medical technician in Rockland County, about 25 miles outside New York. Same with Pearse Matthews. They both drive ambulances, responding to 911 calls across the county. Like so many places in New York right now, coronavirus has become all-consuming. I spoke to the two of them the other day. As a percentage of the calls you're getting now, how many would you assume are coronavirus cases?
100%.
100%?
100%.
Yes. The rarity of getting a regular emergency, which sounds crazy, a regular emergency where someone needs our help right away and we can do something, in 10 calls, you may have one. So it's almost 100% are either confirmed cases or suspected cases.
That has got to be, I don't know, want to put words in your mouth, but nerve-wracking. Like, if every person you possibly interact with, sometimes very, very close, if you're worried that person has coronavirus, that's got to be, I mean, mentally exhausting.
It is. It is. That coupled with the call volume going up drastically, in most cases more than doubling your call volume every day. So a shift that you might see, 8 patients on, you're getting called to 16 to 20 different houses. We're going from 100 calls a week to 200 to 250. It's intense. It's really intense.
It's scary, and I would say a better word to use is terrifying, especially when you don't believe you have the correct PPE to use. And it's scary. We're scared just as much as the regular person, But, we have to do this job. We signed up for this. This is what we do for a living. And, EMS personnel and hospital personnel are proud to do it. But it's very scary. It's not that they're very infectious. That is obviously the case, that COVID is an infectious disease. But it's also that the people that we're seeing may not live. And as EMS and healthcare workers, we're used to trying to do our best to save lives. So it's emotionally taxing, I think, on the healthcare personnel.
Last week, me specifically, there were at least 3 patients who I had seen earlier in the week who I came back to work a couple of days later and found out they had passed away. I was just there. How quickly, was that she went from being alive to not alive anymore, or he went alive to not being alive.
That's got to make the statistics that we see, these numbers and cases going up every day, we see them as bar charts, but for you guys, it seems obviously a lot more visceral.
Yeah, it's not a chart, it's not a graph, it's a person who you saw, who you touched, who you spoke to, and now they're not. Now they're, sadly, they've gone on to become a statistic. That's one of the harder parts of this for sure.
Last night, I got off at 2 a.m. I went to a friend's house to evaluate his father, who is bedridden, who was diagnosed with pneumonia. I cried from the station to his house, and in front of his house for probably about 2 additional minutes. Because during my shift, I worked for 24 hours straight. I couldn't really, I couldn't really have emotions because I was working. We have to do our job. We all have to do our job. We signed up for this. This is what we have to do. We have to, treat these patients and make sure everything is okay, and, treat the community. And, after the end of my shift, I broke down. I cried, just thinking about everything that I had to see, the patients that I knew probably would not make it.
On top of that, we have the fear. Have I been exposed? Am I going to give it to someone else? All of us, you ask anyone in emergency services, we're all immortal. You can't kill us. And now it's getting closer to home that we need to start considering our own health as well. I think yesterday they were retired guys, but there were 2 firefighters who passed away yesterday from this. Those are guys who gave their whole life to their fire departments. So it's getting closer and closer to home for all of us. It's no longer, if we're going to be exposed, that's gone. We're all going to be exposed. We don't know when.
On top of the stresses of the job, of worrying whether they themselves might get sick, many EMTs also have to work for low pay and few benefits.
The average salary for an EMT in New York State, doing what we're doing through all of this, is about $37,000 a year.
Wow.
Yeah, right now, both Pearse and I, everyone who's doing what we're doing, we're juggling, usually it's 2 or 3 jobs just to keep working so we can pay our bills. We do this because we love it. Everyone knows there's no money in it. But right now, I'm doing all of this with no health insurance.
No health insurance?
No health insurance.
How is that possible?
It
doesn't come through the job.
The job doesn't offer it, and our affordable marketplaces aren't very affordable. If I get sick and I go get tested positive, I can't go to the hospital. Literally life or death is what's going to put me in the hospital. It's scary. And, people come out and they show us the support, and I love it. I've eaten so much pizza in the last 2 weeks. It's been great. I don't need pizza. I need to be able to pay my bills. I need to be able to work a 40-hour work week and live like a normal human being.
I know you guys have probably seen all these videos of people clapping out when there's a hospital shift rotating out. And I mean, I hope you know that everybody out there does on some level appreciate how crucial you all are to keeping all of us safe.
I appreciate you saying that, and it's tremendous support, and we need it because it's not easy. It's really not easy. We're scared also. The general public is scared about this virus, and we are too, but we also know that this is our job, and we love to do this. This is something that you have to have passion for, helping people, and on the medical side, just making sure, fixing people and making sure they're okay is something that we like to do. We love to do it. So it makes us feel really good when we feel the support from the regular people and also from other agencies like police and fire. I appreciate that a lot.